Students in Los Angeles are heading back to school after the winter break, following 3 weeks of intense media coverage of the deadly shootings at Sandy Hook Elementary in Newtown, Connecticut. Students are bound to have questions about the tragedy and concerns about their own safety at school. How should teachers respond? I'm joined by an expert who's here to offer some help. Sharon Williams, who's a K-12 educator and a school psychologist for LA Unified. Sharon's also served on the district's crisis team. Sharon, should teachers wait for students to bring up issues with them, or should teachers initiate the discussion?
Well, Warren, I think that teachers should maintain the same routine that they had before the winter break. It provides students with feelings of security and safety. They should provide reassurances to their students that the campus is safe and let them know that, that they are there to support them should the need arise.
This tragedy took the lives of children as young as 6 years old. How do we adults talk to kids about that kind of event?
Well, adults should model controlled and calm behavior because children are our greatest imitators. Explanations should be given to the students or the children in simple, age-appropriate language, and we should acknowledge the fact that we don't understand why things like this happen and that some adults have difficulty managing their anger or are ill. They should be provided with simple, brief explanations.
When should a school psychologist or other health and human services professional be brought into the conversation?
Well, normally when students return to school, there's a period of adjustment, and if students' behaviors warrant concerns, then a teacher should try interventions such as giving the student a quiet corner to take a break, or having them have a private talk with the teacher, or even giving them an ability to journal or express their feelings in an age-appropriate manner. And if these interventions don't appear to work, then I think it's time for the teacher to contact the parent and also refer the student to a health or human services professional or a psychologist on campus for consultation.
We know that teachers and administrators and the other adults on campus are also going to be afraid for their safety. How do we advise our colleagues in how to deal with these kinds of situations and processing this so that they're not overwhelmed?
Well, one of the things that this provides is for an opportunity for us to work together, for us to review our crisis team plans, for us to get together as the school communities and to review those plans. It is also a time for us to monitor our own personal stress levels and to do or participate in healthy activities that cause us to relax and reduce our stress.
You've been trained to handle all sorts of traumatic and emergency situations. Where can our UTLA members go for resources and assistance right now?
Well, the UTLA members can consult their school psychologists, their psychiatric social workers, and their counselors that are on their staffs for referrals to handle individual student concerns and for referrals to community agencies and resources. There's also the National Association of School Psychologists and the California Department of Education that has tips for teachers and tips for parents, and those are available in several languages. Teachers that are experiencing additional distress or concerns can also consult the district's employee assistance program for supports as well. This is a time for our staffs to come together and work together and join in unity and to make our school communities as safe as possible, working together.
Well, thank you, Sharon. We really appreciate this. It's a special challenge we face, and I want to say on behalf of the teachers of LA Unified, we deeply, deeply are grateful for the work that every one of you Health and Human Services and student mental health people do every single day.
Thank you so much.
Thank you.